I'm here with Bonny Specker, who is going to give us an update with what has been happening with COVID-19 in the state, in our region, across the United States, and in the world over the last week. Bonny, what has been happening with COVID-19?
Well, thanks, Chelsea. A lot's been happening. I think the data look pretty good. There's some new data that I'd like to share that comes out monthly from the Department of Health. And again, just to remind people, all these slides are on the website, the city website, so they can look through them and if they have spare time. But this is for data up to yesterday, the 17th. Brookings County is back in substantial spread. This is the number of cases last week and that before. You can see we were doing really good dropping, and the last 3 weeks we've kind of made a turnaround and have started coming back up. The total number of cases as of yesterday is 3,672. We had 42 new cases last week compared to 31 in the week before. So it would be nice to get that either, leveled out and then back down again. And hopefully this isn't the beginning of another peak. We did get updates on the age distribution of the Brookings County cases this past week. And I think it's really interesting to note and exciting that this is the second week in a row that there are no new cases in the 70+ age group. I'm sure, as everyone's aware, this is the age group that has the bad outcomes, and it's also the age group that has a high percent that are vaccinated. So hopefully this will continue to show low number of cases here. The biggest age groups are the 20 to 39-year-olds. They had the highest number of new cases this past week. As far as hospitalizations, we've had a total of 133. Last week, we actually had 5 hospitalizations, which is the most it's been since December. The previous week, we were down to just 1 hospitalization. So this is hospitalizations of Brookings County residents. It's not necessarily at Brookings Hospital. They could have been hospitalized anywhere, even outside of the state. This is for residents only, hospitalized anywhere. As far as the state hasn't gotten below substantial spread since back last summer in August. We've got close to 115,000 cases, but we are pretty steady, and this has been steady for about 7 weeks at around 1,000 cases per week. So not ideal. It would be nice if this continued to go down, but it seems like we're stuck at that substantial spread. As far as statewide hospitalization data, yesterday there were 68 people hospitalized. 10 of them were in the ICU. We've had close to 7,000 hospitalizations since the pandemic started. Last week there were 84 new admissions compared to 82 the week before. So just like the new cases, the hospitalization data looks like it's starting to plateau at about a little over 10 cases a day. As far as deaths, these two look like they're plateauing at about 11 deaths per week. The total deaths close to 2,000. This is some new data. These data are updated once a month by the Department of Health on their statistics website. The links are shown here. This is the number of deaths in South Dakota by month, and each of these different lines represents a different year. And this blue line represents 2020. The 2020 and 2021 data are provisional, which means that it can change in the future. It hasn't been finalized. And that's normal. There's usually a lag in the final data set. But one of the things I want to note here is you can see that since about June, 2020 started being a bad year when it came to deaths and pretty much exceeded all the previous years between 2010 and 2019. This is 2021, January's data. We're up still. But if you look at just the 2020 total deaths, there were 9,856 compared to an average of 7,602 between 2010 and 2019. The difference between these numbers is 2,254, which we call excess deaths. They're more than what we expected based on the average. And the COVID deaths on the dashboard for 2020 came out to close to 1,500. So there's about 700 additional deaths that were not attributed to COVID that occurred in 2020. And this could be that from people not getting to the hospital when they were sick with other diseases, or the hospital system being overwhelmed. It's what we refer to in epidemiology as excess deaths. And we did do a little brief introduction to that. And maybe you could provide the link for people if they want to look at that on the website. As far as vaccinations, you can see what happened here. We have a huge increase in the number of people that have received at least one vaccine a couple weeks ago and then again last week. And these are the pods. So there have been, a large number of people vaccinated during these pods, and it's allowed us to get closer to where the rest of the state is. South Brookings County is at about 25% of the population that has received at least one vaccine, and 11% that's received or fully vaccinated. And there's several pods coming up, but that will help us get people vaccinated and reduce the number of cases. If you look statewide at the percent of the population that's received at least one vaccine, this is highly correlated with age, and that makes sense because they opened up vaccinations to the older age groups first, since they're the most vulnerable populations. And these data are updated each week, but you can see that 73% of the 80 plus and 70% of the 70 to 79-year-olds have been vaccinated statewide. These numbers down here should start to increase now that they've opened it up to the 60 plus and to students and teachers. So these numbers will start increasing. Just a note, the previous slide that I showed on vaccination does not include vaccines given by the VA or the IHS, the Indian Health Service. This particular slide does include the VA and IHS data. Also updated this week were the mobility data, and this is the mobility data for Brookings County, and it's the percent change from back in January of 2020. And the yellow line is the number of visits made to non-residential areas, whereas the white line is the percent time spent in residence. And what you can see is initially we had this big drop. People didn't go out. They were spending a lot of time at their homes. And, this has gotten to be more normal, but it's still different than what it was at the baseline. People are still spending about 5% more time at home than they did back in January of 2020. And they're also going out less often, as you can see, with this being below 0. These dips here, these are holidays where people are spending more time at home and not going out as often. So I think that's interesting. If you look at it statewide, though, statewide, the mobility is about where it was at the beginning of the pandemic. There aren't as many people staying home, and they're going out more about the same as they were back here. So Brookings County is being a little bit less mobile than the rest of the state. As far as the United States, we have 30 million cases. You can see that it's plateaued out as well at a fairly high level. Plateauing is good. It's better than increasing, but really what we need it to do is decrease and get down to a lower number. We've had about 430,000 cases per week in the last 2 weeks. As far as deaths, those did drop this week to a level below. We haven't seen it this low since before November, which is a good sign. We had about 8,700 deaths last week compared to 11,000 deaths in the previous week. There have been a total of about 550,000 Americans who have died so far from this pandemic, which is a pretty staggering amount. Globally, we're at 121 million cases, and this has increased from about 2.9 million last week to 3.1 million this week. But the deaths actually dropped a little bit and have plateaued out globally as well. 2.6 million deaths with about 61,000 deaths occurring per week during the last 2 weeks. So a couple other things I just wanted to note. There have been 2 cases of the SARS UK variant detected in Minnehaha County. The Department of Health does not screen every positive test for these variants, so it is likely that there are more of them than just these 2. This variant, last week there was a publication that came out in the scientific journal Nature showing that this variant may actually have a higher mortality rate or case fatality rate, and it is known that it spreads more easily than the original SARS-CoV-2 virus. This variant is was the reason why people were talking about double masking last month, was because that's one way of preventing the spread of this particular variant. It's important to note both Brookings County and South Dakota still have substantial spread. Good thing is that the numbers vaccinated are increasing, and the faster we can get people vaccinated, the better, especially when it comes to spreading of this variant. We are getting close, but we're not quite there yet, and we really need to be following those CDC recommendations of masking, socially distancing, avoiding crowds, washing hands, and avoiding the poorly ventilated spaces. So that's it for this week.
Well, thank you so much, Bonnie. I always look forward to getting caught up with what's been happening with the COVID situation over the last week. For those of you that watch every week, if you have a question for an epidemiologist for Bonnie, please email us at the link that is listed in the description of this video. We will talk to you next week.